Good morning. This is Dr. Nemechek of the Nemechek Protocol in Buckeye, Arizona. And I want to talk to you today about what's the difference between a sore throat from strep or a virus and, say, a sore throat from reflux of acid or a sore throat from sinus drainage, because you don't want to overtreat your child, right? And so I thought I'd give you just a few basic internal medicine pointers. Now, the one thing we want to make sure we do right is diagnose strep. And so there's things you do and don't to make that happen, because severe strep in this form can be scarlet fever or rheumatic heart disease, and we want to avoid that. So what is strep throat? Or first, it's called pharyngitis. That means sore throat. It's an intense pain back here, often with chills or fever. No prominent cough. Okay, if you have a prominent cough, you got to look for sinus drainage. The doctor needs to look for postnasal drainage. Runny nose, that's not strep. Okay, it's not pharyngitis. It's not coughing up a lot of stuff and having a sore throat. That's more bronchitis, or maybe you have to worry about pneumonia. All right. And you have to have a fever. So if reflux of acid is doing this, there's not going to be a fever. And so pharyngitis is pain, and you're going to see redness, or what we call erythema, in the back of the throat. You don't need to see pus on the tonsils. That doesn't really help with anything. That doesn't mean you have strep or not have strep. So pharyngitis is pain in the back of the throat, no cough, a fever, kind of febrile, hot flush kind of thing going on. Now, that little scenario, your kid has a day or two of really intense pain here, all right, and the fever, that can be two things. That can be a virus, or that can be strep throat. Now, a virus will spontaneously go away in 2 to 3 days, all right? Now, it can kind of get better and then turn into a sinus infection, where now you have the drainage and coughing. So you have this little dip and then a secondary sinus infection on there. But the sore throat part, the pharyngitis from a virus, is very short-lived. It only lasts, really, symptom-wise, 1, 3, 4 days tops, okay? And when I say 4 days, I mean they're getting a lot better on the 4th day. All right. Now, so generally, I wouldn't go see anybody until 4 or 5 days, because what you want to do, because if you see it just getting better, it's not strep right off the bat. Now, some people will say, well, why don't we just go get a strep test and find out? Well, because, hold on to your hats, because 10% of the entire population, and the numbers range from like 9 to 12 or something like that, but let's just say 10% of the entire U.S. population is always positive on a strep test, all right? They're always positive because they're carriers of a very mild, harmless strain of Streptococcus pyogenes. That's the bug that causes strep pharyngitis, all right? So the meaningfulness of the test is really you don't have a cough, you have a fever, you got stuff, it's gone on for a couple days, then you do the strep test. When it's positive, it really reinforces what the doctor should already think you have. You don't go to the doctor one day in, get a strep test, oh, it's strep, and get antibiotics. You never do that. The doctor's not supposed to order the test that way. It's not how it's done, because you have a 10% chance. So there's a bunch of kids that are being treated over and over and over, but with common viral sore throats, because you take them there right away, and they're carriers. They're always going to be positive. The antibiotics don't get rid of this carrier state, and they're always going to be positive, and you keep thinking they have strep. All right. And this is part of what gets all the confusing in people with pandas and this whole thing. All persistent strep. That's 1 out of 10 kids is always going to have strep. And these will also grow in the laboratory. All right. No test in medicine is perfect by any stretch, and that's why we have these little rules. So if you have sore throat, no cough, all right, you aren't coughing up copious stuff, there's no runny nose, wait for 3 or 4 days, 5 days if you can, because there's a very good chance it just goes away no matter what the strep test is. All right. If it persists beyond that, then you do a strep test, and if it's positive, that helps confirm, then I would agree you need antibiotics at that point. Now the other thing is, pus on the tonsils, white stuff on the tonsils, does not in any way indicate you have strep. Okay? Viral pharyngitis can do the exact same thing. All that pus means is you've got an immune response in that part of the throat. It does not mean you have strep. So, fever, sore throat pain, wait a few days, often it just goes away. If you got coughing or runny nose, you got something up in the sinuses, it's not strep throat. Don't do the test. Okay? And only if that persists beyond 3 or 4 or 5 days, no improvement, you go get the test. If it's positive, then I would agree that child needs to be treated, because antibiotics are not necessary for a viral sore throat because they go away. Antibiotics are often not necessary for sinus drainage because those typically will go away without any antibiotics. Ear infections, if that's a prominent thing and causing a lot of symptoms, you need to treat that. If it's just kind of it's a little mild thing, just wait, have the doctor recheck in a week. Oftentimes that can even spontaneously go away without harming the child. Okay? So hopefully these little rules will help you kind of assess if you're getting good care. A lot of providers, and we have a whole range of people with experience out there now, they kind of, when you bring somebody to them, many of them just want to kind of provide a service, and often that means, they think their kid's sick enough, I'll just give them antibiotics, and that's just going to jack up your kid's bacteria even more. All right? So I hope this is helpful. This is Dr. Nemechek of the Nemechek Protocol in Buckeye, Arizona. Have a great day.